Hey there, and welcome back to the Human Wellness Journey. My name is Sarah Carter, and we're here to chat about digestion and ways that you can combat difficulties with digestion, especially acute, even chronic, but flare-ups that feel acute, things you can do at home to help yourself out. So this is part 2 of our series. If you have digestive issues, highly recommend you check out part 1, which is tips and tricks, things you can take over the counter, supplementation, for example, foods. So that's part 1. Today we're here for part 2, and this is acupressure for digestion. I highly recommend acupuncture. If you're in a part of the world where you can find acupuncture, I highly recommend exploring it. Talk to an expert, get your tongue and pulse read, and they will come up with a point prescription that is just right for you and how your digestive issues are manifesting. Today, I'll share a couple general points that help in most conditions of digestion so that we can all benefit from them. We'll start by sitting in a comfortable position. The point that we'll start with is called stomach 36. And so if you have your knees out here, so check out your knees and just come right down off the knee. And then right over to the right. So your shin bone runs here and you have a soft muscular section on the right hand side of your right leg, the left hand side on your left leg, and the top of that fleshy muscle right off the kneecap is where we're headed. And stomach 36 is a large point, so you can use a couple of fingers and really get a deep kind of achy sensation with a fair amount of pressure. I'm using the amount of pressure that I might use if I were pushing down on someone's shoulders for a massage on their neck. So just with pressure, you have a few options. First, if this feels like too much, you could add lighter pressure instead, or even a gentle tap to the acupoint. If you have no difficulty with this, maybe you have a fleshy shin muscle, you can really get in there, make small circles in either direction. I like to go in both directions just to neutralize things. There is some energetic indication for the directions, but if you're going in both directions in such a general point, we will get the benefit. And so just tune into your breath and lean into the feeling of pressure at this point. If you need to take a break, you can come back to pressing. Great. And so next we'll explore do 20, which is a point at the top of your head. So not at the direct center top, but just slightly back. And this point should be tender, it often is, and it's more important to find that tender spot than to worry too much about exactly where you are on the head. But if you're not sure, you can check out your ears and notice their level and then come up straight up from your ears and feel around for that tender spot. And then gently, with circles, tapping, or just light pressure, stimulate that acupoint for a couple of breaths, a couple of moments, maybe 10 seconds. And this is a great point for regulation. So if you're having vomiting, if you're having nausea, acid reflux, or if you're having frequent diarrhea, this helps the body's energy move in the direction that it's intended to in the cases of when it is rebelling, going the opposite direction. This is a great general wellness point. So even if you don't have that type of digestive issue, this is a great point to use. All right. Next, we'll explore point CV12. So this is a point on the abdomen itself, and sometimes if you're having abdominal pain, pressure on the abdomen is not comfortable. So I'll show you how to locate this point, and you can explore how it feels in your body and listen to your intuition. If it feels like too much, then stop. But this is a great point, and even gentle pressure can stimulate it. So to find the point, come to the bottom of your rib cage and kind of feel where your ribs end. And then notice they come all the way up to a tip, almost like an upside down V shape. And CV12 is just a couple of inches down from the top of that V. Oftentimes, if you look at your abdomen, there'll be a natural line across you where your abdomen has a wrinkle almost, and that is often where CV12 is located. This point for me always has some tenderness, and you might notice that same tenderness. Many acupoints are tender with pressure. It's part of how we learn exactly where they are. And oftentimes practitioners will ask you if you feel tenderness here in order to determine if it's the right point. This point can also feel sensations of heat, even a tickle or feeling kind of like you want to scratch it. All of that is normal sensation, and as you press on this acupoint, CV12, you may feel some of those sensations of itchiness, heat, achiness. Just spend a couple of breaths, a couple of moments here pressing on CV12. And then next, we'll head to PC6. So this is on the arm, and pericardium 6 is a great point. Again, nausea, morning sickness, acid reflux, anxiety, especially as digestion is flared up by anxious experiences or anxious feelings. So you might find people locating this point and many acupoints slightly differently. There are two pericardium points very close to one another, 6 and 5, and both are great. So worry less about exactly where you are, and we're gonna go for the achiness that you might feel. So find your wrist crease, right where your wrist meets your hand. There's two. We want the one closer to the hand, and take 3 fingers and use those 3 fingers to measure from your wrist crease up your forearm. And then right at your pointer finger, between the 2 prominent tendons there, very clear prominent tendons for most of us. If you're not sure what I mean, try making your hand into this shape. So I've just brought my fingers together, and that will help you to pop out the main central tendon. And you're just gonna go to the thumb side of that tendon. And again, the more important thing is to find an ache. So I like to use the point as a large point, maybe even stimulating both pericardium points in the process, which is fine. They both are great for digestion and all things related to digestion as it concerns anxiousness. And so we want to really dig in. I'm pressing down so that my flesh shifts about a 1/2 inch. And there's another acupoint on the other side of the wrist that's a great supportive point. So you can even come in with the hand and almost as though you're pinching your forearm. Hope you can see this. I'll kind of move around. And so I have my pointer finger in the top of my forearm and my thumb on the palm side, the bottom side of my forearm, and just giving it a real good achy squeeze. Again, listen to your body. If your energy is sensitive, in my opinion, a great thing, then you may not need as much pressure. So just lighten up there. And you have this point on both sides. You have almost all the points on both sides. So you can stimulate both, especially if you're really feeling it. And I will say this point can stop you from vomiting while you're over the toilet. So just know that it is powerful. You can dig deep in. Sometimes I'll leave a little fingernail print. I don't want you to go deeper than that. No bruising. No breaking the skin, just pressure, right? Okay. So 2 more points. These are a great multi-purpose set of points. And the one caution I will give is if you are unwell, significantly unwell, your body is deficient, maybe you're underweight from your ideal weight for your body. If you are struggling with something chronic that has you really worn down, malnourished, then these 2 points can be too much. So please use caution and know that acupuncture and acupressure are powerful. And so being general like this has a little bit of caution to go with it. So we'll start with large intestine 4, and this point is in the webbing between your thumb and your pointer finger. And you want to stay right kind of in the halfway point, just off the bone. There's a nice hollow, and then start there looking for that achy sensation. Again, a pretty sizable point. Some acupoints are small little crevices between bones or tendons, and others have a larger bit of flesh. So you can really get in there and almost grab at that whole muscle. When I'm at the dentist, I always use this point to support pain in the head and face, but you can really get in there. Generally, this point is hugely circulating. So much of our digestive issues come from stagnation of our lifestyle, our bodies, the food we eat, the types of food we eat, overeating, large meals, difficult to digest foods need some support, and increasing the flow of your circulation is a great way to do that. So this point, again, one you have on both sides. You want to dig in there, feel that ache, maybe 5-10 breaths worth of time. Don't leave any bruising, no need to push that hard. So after you've stimulated large intestine 4, the last point I want to show you is on the foot. So I'll give you that caution. If you're someone who hates seeing feet, now's a great time to close session 2 of digestion. I'm not going to give much else other than this last acupoint, so you won't miss anything. Otherwise, if feet don't gross you out, I will show you where liver 3 is located, and it is almost the exact point as large intestine 4. And I say that from the perspective of location. So if you thought of this as your big toe, your thumb, and if you thought of your pointer finger as your second toe, that's where we're headed on the foot. So you're going in between your big toe and your second toe and follow it up until you hit the bones that again make a V shape, or a Y shape in this case. And again, with pressure, seek a bit of an achy sensation, find that achiest spot. And you want to stay in the meaty part between these 2 bones of the big toe and the second toe. If you've gotten all the way up to the area where the skin stops, like the in between the toe section, you're at liver 2 and you've gone too far. So come back just a little bit into liver 3 and give that some time, give it a few breaths, and give it some pressure, whatever feels comfortable today. So these acupoints can be something that you do while you lie on your back. Remember, you have these points on both sides. So take your time and stimulate them, and they might leave you feeling pretty relaxed. I highly recommend that you lie flat on your back and spend 10 or 20 minutes lying flat after you stimulate them, and let them do their work. And once you've had a chance to fully stimulate liver 3, you've completed my short general acupressure points for digestion support. I hope this brings you relief. Know that you can use these multiple times a week, and subscribe or give us a like, and then check out the 3rd video in this series, Digestion 3. Stay tuned.